If a man is working in a government job, he will not leave his
Yes,
job
yes,
if he
yes.
will get children or. But एक वुमेन को ये छोड़ना पड़ता है, क्या उसमें मेन की भागीदारी नहीं होनी चाहिए कि एक वुमेन को भी अपने जो कर रही है लाइफ.
Yes, so everything considers, no? Take care of the children. No, than a father, I have a more responsibility because we are blessed to have children, and a woman only can do this thing.
One woman asked to her that when I was working, due to my children, I leave my job. And you are also saying that due to your children only, due to your family only, you started your private clinic. What is the solution of this?
I think a little bit break will be there in every woman's career.
लेकिन everybody don't have that. प्राइवेट जॉब अगर है तो वो एक करियर में अच्छे जा रही है, उसके बाद जब बेबी होता है, ब्रेक होते हैं, फिर से अगर वो स्टार्ट करते हैं तो उसके साथ ऑफिस में भी कॉम्प्रोमाइज कराया जाता है.
Yes.
फिर उसके साथ फैमिली की भी दिक्कत होती है, तो कहाँ उसको सपोर्ट मिल रहा है? सोसाइटी इज ऑल्सो नॉट सपोर्टिंग, फैमिली इज ऑल्सो नॉट सपोर्टिंग, देन how she will survive?
So actually, that is completely depends on the capability of the woman.
The reason of women are neurological disorders. Diabetes also nowadays big problem. How you treat Ayurveda?
So Ayurveda is always prescribe the patient.
अभी मैं देख रहा हूँ आपके वेट मैनेजमेंट के लिए भी आपके पास एक इसको कैसे आप
Any hormonal issues or any hormones means any thyroidal issues. There are so many things.
many people are preferring Ayurveda, but it is very costly also. About what about you?
Sometimes we cannot see the affordability. Just we should use the medication. So sometimes it will be burden for the patient only, but they should.
मैम HYBIZ TV में आपका स्वागत है. आपकी जर्नी कैसे शुरू हुई?
Thank you, Shashi. I am Dr. Rajya Lakshmi. So I have completed my graduation, that is BAMS from Tirupati SV Ayurvedic College, and I have completed my post graduation MD in Ayurveda, that is from Dr. BRKR Government Ayurvedic College, Hyderabad. So after completing my PG, I have worked as a government medical officer in different districts in the Telangana. So after that, there was a conflict between my profession and my personal life. So I used to have my duties at very remote areas in rural areas. So I cannot cope up with my family work and professional works. So slowly I have focused on my private practice. So first I have started as a clinic, Ayurkalpa. So it's just I used to see the OP, that is only outpatient facility was there that time when I have started. It started into so parallelly I was working as a visiting professor in different Ayurvedic colleges in Karnataka. So after improving my OP, I have planned why should I stop OP level only? Why can't I spread my clinic in some other areas? Like that I thought. So I used to have a small OP in Kukatpalli also. So 2 clinics I ran parallelly. So slowly I expanded my clinics to Panchakarma centers. So where we do all Kerala Ayurvedic therapies here. So for all chronic ailments, we do the Panchakarmas here, and parallelly we do some diet counseling and some Nadi Pariksha. So now currently we are at Kondapur and we are running a OP only in Kukatpalli.
What type of treatment you give the?
So we do the detoxification therapies and rejuvenation therapies and relaxation therapies for all chronic ailments. And we do the diet counseling and the lifestyle modifications we advise to the patients. And we do the Nadi Pariksha, which is essential for each and every patient to know their body constitution. After knowing the body constitution, we will give them the diet advices and the lifestyle modifications. Then only we come for the medication. If it is not happening with the medication, then we will go with the detoxification therapies like Panchakarmas and some other Upakarmas. We mix and match the things according to the need of the patients.
Nowadays, many people are preferring Ayurveda treatment, but it is very costly also. What about you?
Yeah, sometimes if the disease settles in the body, if it become very chronic, so that time only we use some mineral compounds. So generally at the starting of the disease, we go with the herbal products, so which are very cheap. For instance, Triphala Churna, Hingvastika Churna, Panchasakara Churna, those are very cheap in cost wise. So if the disease settles and if it is more of severity, then we go with the herbo mineral compounds and mineral compounds. So the mineral compounds are little bit high because the minerals, the purification, all this process, no, the process costs. And the mineral also sometimes it will be a little bit expensive only, we can say. But with according to the patient's affordability, we do the treatments. We use the herbs and we use the simple minerals which are low cost, but we don't do all expensive treatments to all patients. Depends on the chronicity of the disease. We sometimes we cannot see the affordability, just we should use the medication. So sometimes it will be burden for the patient only, but they should take the treatments, because we cannot give the cheap medications which are not purified, all that stuff. We go with the genuine medication. That's why sometimes it may be little bit expensive.
Okay. Many big hospitals which give allopathic medicines, they accept health insurance, and nowadays government is also giving this insurance. क्या आप उसको एक्सेप्ट करते हैं? आप एक्सेप्ट?
No, actually, we so many patients are coming from different sectors here in Kondapur. So we give the bills, everything. They used to reimburse from their offices, everything. Insurance also now, Ayush Ministry included all Ayush doctors in the insurance coverage. But the centers who has this NABH accreditation, they can give the insurance actually. They can claim the insurance from that kind of centers. Currently, we don't have NABH accreditation.
So means here,
yes.
private health insurance, so like we take.
Yes. You should ask your insurance agent, but generally it is the coverage is there in for Ayush doctors also.
मैम अभी आप बोल रहे थे कि you as a government employee, but you are not able to handle your personal life and professional life. So you started this journey. You are a doctor, और अभी जो है महिलाओं के लिए बहुत कुछ हो रहा है. फॉर वुमेन्स देयर बहुत कुछ हो रहा है. लोग बड़ी बड़ी बातें कर रहे हैं कि शक्ति है, स्ट्रॉन्ग है, लेकिन एक कंडीशन तो है कि एक टाइम पे आकर के आपको ही हैंडल करना पड़ता है, और आपकी गवर्नमेंट लाइफ को, अपनी गवर्नमेंट जॉब को छोड़ करके कि मेरी पर्सनल लाइफ ठीक रहे, आपको एक प्राइवेट क्लिनिक ओपन करना पड़ा. इसके बारे में क्या कहना चाहते हैं?
So it all depends on their particular their family situations like that. Some people, they can handle both the things very effectively.
But very few people can.
Yes.
They don't get support like that.
Yes. That is the preference the woman gives to family or professional life, that purely depends on their family circumstances. So I gave a little preference to my family because my kids are very small that time. So I gave a little bit, I bended towards my family, this thing only, family responsibilities. So I started my own. Here also I am not doing less. I am doing more only in private practice also, not less than as a government medical officer.
No, I'm not saying that you are not doing less. You are doing good job here. मैं एक बात करिए, मतलब एक मुद्दे की बात ये है कि एक वुमेन जो है, एक वुमेन को अपनी प्रोफेशनल लाइफ जो है छोड़नी पड़ती है. एक मैन अगर है, if a man is working in a government job, he will not leave his job if he will get children or something. But एक वुमेन को ये छोड़ना पड़ता है. क्या उसमें मेन की भागीदारी नहीं होनी चाहिए कि एक वुमेन को भी अपने जो कर रही है लाइफ?
Yes, that's what it completely depends on the understanding of the couple and understanding between the family members. So everything considers, no? So in my family, my husband is little bit busy. I need to take care of my kids because as a mother, I should take care of the children. No, than a father, I have more responsibility. I feel like that because we are blessed to have children, and a woman only can do this thing. So
I was watching an interview of Sudha Murthy, one woman asked to her that I had small boy and I'm going office, but I'm feeling that if I'm going, he is not good. So what should I do? She also told that when I was working, due to my children, I leave my job. And you are also saying that due to your children only, due to your family only, you started your private clinic. So I got that this question that how what is the solution of this problem?
But I think a little bit break will be there in every woman's career during the bringing up of the children, all these
हाँ
things.
मैम लेकिन ठीक है आपके पास ऑप्शन था कि और आपके पास ऑप्शन था आपके पास बैकअप भी था यू हैड मनी बट यू कैन ओपन क्लिनिक लेकिन एवरीबॉडी डोंट हैव लाइक दैट तो ऐसे कंडीशन में क्या होता है कि अगर एक प्राइवेट जॉब लड़की करती है गवर्नमेंट जॉब है तो ठीक है जितनी छुट्टी है वो मिल गई प्राइवेट जॉब अगर है तो वो एक करियर में अच्छे जा रही है उसके बाद जब बेबी होता है ब्रेक होते हैं फिर से अगर वो स्टार्ट करते हैं तो उसके साथ ऑफिस में भी कॉम्प्रोमाइज कराया जाता है उसको अपनी सैलरी नहीं मिल पाती है जो पहले से उसको मिलती थी फिर उसके साथ फैमिली की भी दिक्कत होती है तो कहाँ उसको सपोर्ट मिल रहा है सोसाइटी इज ऑल्सो नॉट सपोर्टिंग फैमिली इज ऑल्सो नॉट सपोर्टिंग देन how she will survive.
So actually that is completely depends on the capability of the woman. She can manage both the things. It depends. That's why I feel that every woman should be healthy first. So if she is healthy, she can think healthy. She can do wonders because health is wealth nowadays. So the woman should be very healthy. As a doctor, I concentrate on the health of the woman only. So then she can think better. She can do better. She can choose the better options, and she can succeed in that professions. So I feel so many supports from banks we are getting nowadays. You need not have the back end money, back end properties. So you can avail the loan facilities. A little bit of loan you can take. Even I did not spend so much on my private clinic. I went in a very smooth manner only. I never struggled for the things here. So I started very small, with very small amount I started. Do you believe I started my clinic with 50K? Simply I have one room I have taken. So I used to see the patients. Now we grown this much. So now we are spending so much and we are doing so many medications. We are doing so many other things for the well-being of my clinic and these things.
2016 I think you started.
Yeah, 2006 actually.
2006 you started.
Yes, we started.
50K. Okay.
Yes.
It is very
yes,
big
yes.
thing that a person can start
Yes,
from.
yes. Now we have a small pharmacy we are running along with this clinic. We manufacture some medications which are useful for the patient by our own pharma. We are running a pharmacy ecology.
Okay, what is the process of start the clinic and there is some approval from government also?
Yes. We have taken the some registrations from shops and establishment registrations, and we are looking for the registration from Ayush department, and I have my own medical registration. These are the simple things we need to have before opening a clinic or Panchakarma centers. So simply 1 month, within 1 month I got all the things.
Looking here nowadays, this is a big problem.
Yes.
For youngsters also, for old person also, and if youngster don't get something in their life, they go in stress.
Yes.
Old person also go in stress. Then how you reduce this stress from this stress management?
So actually nowadays mental health is very, very, very important. So many are nowadays suffering with stress. So stress is causing so many bodily ailments. So we call it as psychosomatic diseases. So when stress is there, it reflects on your GIT, gastrointestinal tract. So many digestive issues with the stress. So many skin issues with the stress like psoriasis. So many metabolic diseases like diabetes mellitus, hypertension, insomnia. So many are there which are associated with the stress. So first we need to manage the stress. So for that we start with the taking of the history from the patient. What is the root cause for his stress? We first advise the lifestyle modifications to the patient. As soon as they come with the stress problem, we advise the lifestyle modifications. How he is working, what are his working hours, how about his sleep pattern. So all this we take consideration. If there are any targets or any stress in his professional life, So many now night shifts they are doing, no?
Yeah.
So without sleep they are doing so much, and it causes the stress. So first we take the root cause, we change the lifestyle. After that we give some dietary changes also. If you take fresh fruits and vegetables and madhura padartha according to Ayurveda, if any sweet substance, not sweet means not your sugar, jaggery sweets, the vegetables and fruits which are sweet in nature, that should be taken frequently, like your carrot, beetroot juices, like this. We advise some lifestyle, some dietary changes in the diet. And then if it is not happening, then we will go with some medications, and we have some treatments also. So we do some Shirodhara treatment. The Shirodhara is nothing but pouring of medicated oil on your forehead for certain period, maintaining the constant temperature. So these are all stress relievers. So we give some herbs also to do the kashayas, and to simple remedy I can tell, Padabhyanga we do for the stress. So before going to your bed, you do the foot massage with any oil, like we prescribe Ksheerabala Tailam. So you can do massage with Ksheerabala Tailam your foot, then you will get good sleep. So simple medication. This is not expensive also. So you can do that. If you are you're not available the Ksheerabala Tailam, you can go with even simple coconut oil or til tail, any oil you can take.
Okay, what is the reason of, ma'am, neurological disorders and how you treat?
So neurological disorders, there are so many neurological disorders. Some are degenerative, so which occurs due to the aging. So many, depends on the cause, we give the neurological disorders treatments.
And the diabetes also nowadays big problem. How you treat in Ayurveda?
So Ayurveda is always, we prescribe the patient Nidana Parivarjana. So that is restricting the etiological factors. So why diabetes will come? Asya Sukam, Swapna Sukam, Mandakam Dadicha. So this is the etiological problem. Asya Sukam means always taking very good food, which is Sukam for your, which gives Sukam for your mouth. That is gut. So that those are nothing but sweets. Swapna Sukam, who are managing the sedentary life. Swapna Sukam means always sitting posture or sleeping. Mandakam Dadichi. So who take the curds which are not curdles properly. So that curd also cause the diabetes. And Adhika Chintana. So thinking too much stress. So these are the reasons for the diabetes mellitus. Madhumeha we call it as. So this should be avoided. So the etiological factors should be restricted first. This is the 50% of treatment. Then only 50%. So for every disease, Ayurveda emphasizes on Ahara, Vihara and Aushadha. So first we correct the Ahara, that is the diet. Next we correct the lifestyle, that is Vihara. And the last thing is the medication, that is the Aushadham.
And weight management, आजकल बहुत लोग जो है खाने को लेकर टाइमिंग सही से नहीं मिल पा रही है, कभी कोई बहुत सारे रीजन से फैट होने के लिए। अभी मैं देख रहा हूँ आपके वेट मैनेजमेंट के लिए भी आपके पास एक, इसको कैसे आप?
So weight management be, we see the root cause first. So what happened? What is causing the weight first? Any hormonal issues, or any hormones means any thyroidal issues, or any stress, due to stress, or because of their lifestyle, or so many things, any diseases, any underlying diseases, all this we consider, then we give the treatment accordingly. Same, like we give Ahara, Vihara and medication, Aushadha. So like that only, for every disease, we consider the diet, lifestyle and medicine. So these three things will we correct.
Okay मैम, अब लास्ट में आप कुछ वुमेन के लिए, वुमेन एम्पावरमेंट के लिए कुछ बोल दीजिए, फिर हम।
Yes, for every woman, I want to tell, your health is very important. If you are healthy, you can think healthy, you can do healthy. So your family, your whole family will be healthy. So be healthy first yourself, then you take care of your family health. Don't neglect your health, because if you are ill health, your family will get affected. So first take care of your health.
Thank you मैम, बहुत बहुत धन्यवाद आपका HYBIZ TV से जुड़ने के लिए और इतनी सारी डिटेल में बताने के लिए।
Thank you.